And indeed, we go back actually all the way to California with Professor Youngwei Chi. In its introduction, he's one of the founders of BWIN, and he's telling us more about how we can use artificial intelligence in phlebology in particular.
It is my great honor to give this talk on what phlebology really needs from AI. I am Willie Chi from the University of California at Davis. I do not have any disclosure related to this talk. As I thought about this topic of AI in phlebology, I remember a talk that I heard from Eric Schmidt, who was the former CEO of Google, gave recently. I think that he has summarized the best. And he said that AI is to create and facilitate efficiency in systems, but not to replace human function, in this case, being physicians. Now, as applied to phlebology, the simple way of thinking how AI will help will be diagnosis and treatment. Simple. But as I researched the term AI in phlebology, only one article that came up of relevance. It has to do with the microwave analysis of temperature differences between the limb that has venous disease versus no venous disease. So that brought me to think more about this particular topic. Now, besides diagnosis and treatment, well, can we elevate a higher level? And what does that mean? Well, what type of treatment will benefit from what type of patient based on ethnicity and other parameters? I think that would be a very useful or a very innovative way of thinking how we're going to treat patient, not as a lump sum anymore, but precision-based medicine. Now, in this San Diego population study, looking at different types of ethnicity and their prevalence to the different type of venous disease from C1 to C6, you can see that it's quite different. We know that there are many types of treatment for venous disease, including our thermal device, including our MOCA device, including our commercially foam production device, such as Varithena Virexio, Cyanoacrylate, which is another non-thermal, non-tumescent-based modality, upcoming devices such as Sclerosafe, IVASC, and HIFU, and pharmacology. Are there any particular type of population with particular characteristics will benefit from a particular medicine for venous disease versus another? And the type of compression. What type of compression will be for a very specific patient? Because right now, currently, all we know is, patient benefit, but would ethnicity-based treatment be applicable to different type of compression therapy? Well, nobody knows the answer to that. So with that being said, I think that the first step of AI, and really, if you look at AI, it's really an algorithm-based intelligence. I don't call it artificial intelligence. I always think that to begin with, it should be algorithm-based intelligence, and that also spells as AI as well. And this is a perfect example of the European 2022 CVD guideline, looking at the different ways of how to treat patient depends on the patient's symptoms. Now, with that being said, Alan Davis and his group actually wrote an article in Phlebology about 4 years ago with the title, Do We Need More Innovation in Phlebology? Well, I think that there's always going to be a need for innovation in any medical field. But I think that AI is also part of that innovation. Simply because that AI is able to help us in better manage our patient, to be more efficient, and then to be more precise in terms of treatment. I already said it, the AI in phlebology really had just began because we have algorithms. So next time you hear about the AI in phobology, you should think about algorithm intelligence rather than artificial intelligence. Now, phobology needs AI in all aspects of its care. I already mentioned the diagnosis, I already mentioned the treatment. Well, let's bring more of those variables, including ethnicity, including age, including body habitus, including all these parameters, weight, functional level, so on and so forth. Because I think AI will be able to help us to tease out the more appropriate treatment for very specific patients, not just on ethnicity, but in addition to ethnicity and all these other parameters that currently are part of the registry, such as the NHS, the VQI, or even the V registry. So what's next? Well, I think that AI is still in the very early stages of phobology. We need to machine train the system. So we need more data, whether it be prospective, whether it be retrospective, whether it be cohort analysis. And with that, I want to thank you for your attention.